Next, we will take you through a live demonstration of the online care service. The landing page is the first screen that patients and providers see when they arrive to your online care service. To access your service, users will need to enter a web address or URL such as mypractice.myonlinecare.com. If you choose to do so, you can customize the URL for your service. Otherwise, American Well can suggest one for you. The landing page also contains the Online Care Service logo in the upper left corner and service name as part of the welcome message. Both the logo and the service name can be customized for your online care service. At the bottom of the screen are links to the terms of use, privacy policy, and legal notices. These links are available at the bottom of the screen throughout the online care service. The landing page allows users to sign into the service based on the type of user. Let's begin with the patient. If this is the patient's first time visiting your online care service, he or she can click here to watch an overview video, and then click Register Now to begin the brief enrollment process and create an account. If the patient already has an account, he or she can enter their username and password here to sign in. Once signed in, the patient will arrive at the patient homepage. Across the bottom of the page are several tools, including a secure message center for communicating with online care providers, a to-do list where online care providers can add recommendations aimed at helping the patient to improve their health, and an area to upload and share health information. If the patient was invited to join the service by one of your online care providers, a preview of the practice lobby will be displayed on the right side of the homepage. The patient can click the link to view the full practice lobby, or select from one of the available providers right from the homepage. There are several other ways for the patient to easily connect with a provider. If the patient is not sure who they need to speak with, they can click the Not Sure Who to Talk to button, and online care will ask a few questions before making a recommendation. If the patient prefers to find a specific provider that meets his or her criteria, the Find a Doctor button will allow them to perform a provider search. Or, the patient can connect immediately with the first available provider by clicking one of the three easy buttons. You will have the ability to customize the provider type for each of the three easy buttons for your service. To show you just how easy it is, I will click one of the easy buttons, and the service will connect me with the first available OBGYN, Dr. Automatic. On the Review Connection Details screen, the patient sees the provider's information and has the option to indicate topics they would like to discuss. To the right of that, the patient can select a pharmacy, which is where any prescriptions written by the provider will be sent. Below that, the patient has the option to respond to a set of triage questions. These triage questions can be set by the practice to apply to all providers. Otherwise, individual providers can create their own triage questions based on their unique needs. If you will be collecting payment for online care conversations, the patient will enter their credit card information and any coupon codes on this screen before connecting with the provider. Finally, the patient will agree to the terms of use and allow the provider to see his or her health summary. This agreement is captured by initialing in the box below, which then allows the patient to connect with the provider. Once the patient clicks Connect, he or she will be placed in the conversation console where they can communicate with the provider using any of the three options. The first is using the webcam to communicate with live video and audio. Second, the patient can communicate with the provider using secure text chat. Additionally, the patient can choose to establish a phone connection, in which case the online care service will securely call both the provider and the patient and bring them together to communicate over the phone. To the right of the conversation console, there are several tools available to the patient. Let's take a look. In the To Start tab, the patient can access the triage questions that he or she was presented with prior to starting the conversation. If the patient did not initially respond to those triage questions, that can be done here. Next is the Health History tab. From here, the patient can reference their past online care activity, including their complete health summary, attachments, conversation reports, health measurements, and completed assessments. These can be shared with the provider during the conversation at the click of a button. Below that is the Provider Entries tab, where the patient can see any notes the provider has taken, prescriptions written, diagnoses or procedure codes assigned, and follow-up suggestions recommended by the provider during the conversation. Finally, there is the Conversation Information tab, which will display to the patient basic information about the provider, topics to discuss, and payment for the conversation. Once the patient's concerns are addressed, he or she can end the conversation by clicking the red button in the upper right corner of the screen. If they'd like to, the patient can add the provider to their preferred list. They will then rate their experience with the provider and your online care service and end the conversation. On the conversation wrap-up screen, the patient can once again see information about the provider, topics discussed, and payment information. The online care service will create a detailed report for each completed conversation that occurs. On the conversation wrap-up screen, the patient has the ability to share that conversation report with another online care provider or a provider outside of the online care service. Additionally, if the patient wishes to follow up with the provider, he or she can add an item to their to-do list or schedule a future appointment with that provider at this time. Following the conversation, the patient will be taken to their to-do list, where they will see a list of the follow-up suggestions added by the provider during the conversation. Follow-up suggestions may include online care conversations, assessments, and self-care tools aimed at helping the patient to improve their health. The patient can take action on any of the items in their to-do list on the right-hand side of the screen, at which time the item is removed from the to-do list. The patient can always reference the item at a later time by visiting the My History section of online care. When the patient is ready to leave online care, he or she can do so by clicking the Log Out button in the upper right corner of the screen.